Forchu. How are you doing today?
Good. How are you?
I'm good. This is Veronica. I'll be a nurse practitioner for today. You're here for a wellness check.
Yes, ma'am.
Can you verify your name for me?
My name is Valerie Forchu.
And your date of birth?
July 1482.
Awesome. So before coming in, I saw that the LPN already checked your vital signs and they were within normal limits, and that your vision was tested with this Snell chart, and it was 20/20. So you see at 20/20. And so for the purpose of this video, before coming, I already washed my hands, and I'm providing privacy for the patient and ensuring that there's adequate lighting. So I'm going to explain what we're going to do today. We're going to be doing a head-to-toe assessment, checking all the systems of the body, from your head to the optic nerve, to the ocular, your nose, your mouth, the pharynx, to your chest, your muscles, your knee, your breath sounds, and your diaphragm. And we're going to be checking your abdomen as well, and your reflexes and your pulses. So to start with, I'm going to visualize this patient. I see that he's dressed appropriately for the weather, his skin color is appropriate for his race, and that he's well nourished, he's looking well, no sickness, he's well groomed, and that his height and weight is proportionate for your BMI, and you smell good. And
Thank you.
I'm going to also be looking at your hair, skin, and nail. So just looking at your hair, you don't have any hair, of course, but I see some gray hair popping up on your head, and they're evenly distributed. You do have some baldness on the front here, on your forehead, and in the middle here you have some baldness. And your skin, I'm looking at your skin, and the temperature is warm and nice, and your hair and your body is evenly distributed. I'm not seeing any deformity. Can I see your nails? Looking at your nails, they are normal, no clubbing, no cracked nails, no chipped nails. And as I have your nails, I'm going to be checking for your capillary refill, and it's 2 seconds, which is normal as well. And so we're gonna move, and we're gonna be checking at your eyes, and looking at your eyes to see that your sclera, your eyelids, and the eyebrow evenly distributed, good eyebrow, no missing eyelids, your sclera conjunctiva. I'm not seeing any drainage, no redness, no swelling, nor evidence of tenderness in your eyes. And moving from there, I'm going to be checking for cranial nerve number 2, which is an optic nerve, and then we're going to check for reaction to light accommodation and your visual peripheral view. So you tell me when you see my hand.
I see it.
You see my hand?
I see it.
You see my hand? Okay. And we're going to be checking for reaction to light. Let me keep my hand here. I'm going to cover your one eye, and I'm going to see. See, your pupil is reactive. That's great. That was okay. Your pupil is reactive. Cranial nerve number 2 is intact. And I'm going to have you look at me, and there you go. Great accommodation. And while I'm here, I'm going to check for cranial nerve 3, 4, and 6. So I'm going to have you follow this. My pen, just with your eyes, don't move your head. Great. Cranial nerve 3, 4, and 6 is intact. I'm going to move and check your nostrils and your sinuses. Looking at your nose, I see that your septum is not deviated. It's normal. I'm going to check inside your nostrils, and I see your nasal mucosa. You do have a lot of hair in your nose, but I see your nasal mucosa is moist. It's pink. I don't see any exudate in your nose, or any drainage or redness or swelling in your nostrils, and your tubular is normal as well. And that is cranial nerve number 8. Your we're gonna check smell, which is cranial nerve number 8. I'm gonna check your cyanosis, and you tell me if you feel any tenderness. I forgot to let you know during the course of this assessment, if you feel uncomfortable, any pain, let me know, and we're going to stop. Okay?
Yes, ma'am.
So I'm gonna check your cyanosis. This is your frontal, ethmoid, maxillary. If you feel any pain, any tenderness,
No, ma'am.
no pain, no tenderness. I'm going to be checking your sense of smell. Can you cover your nose and breathing? And the other side, breathing. Patency, your nose is patent. You don't have any sinuses. You don't have any cold. I don't feel like you have any cold. So close your eyes. I'm going to have you smell this. You tell me what you smell.
Ginger.
Great. So cranial nerve number 8 is intact. And we're gonna move to your mouth, and we're gonna check cranial nerve number 5, 7, 9, and 10. So starting with your mouth, I'm going to palpate your TMG. Can you open your mouth for me? Close it. I don't feel any clicking, any cut, so your TMG cranial number 5 is intact. Can you go ahead and swallow for me? All right, I'm gonna go right behind you and palpate your lymph nodes as well as your thyroid. Swallow again for me. Great. So your gag reflex has been initiated, and cranial nerve number 9 and 10 is intact. And now I'm gonna have you pop open your mouth. Can you wiggle your thumb for me? Up and down. There you go. Smile. Frown. Frown. Pop your cheek for me. Great. Cranial nerve number 7 is intact. And I'm gonna have you open your mouth for me. Say I see your uvula is midline. Your oral mucosa is moist, is pink. There's no redness, no, it's not swollen. Your tonsils are not swollen. Do you feel any pain when you swallow?
No, ma'am.
Great. So we did talk about cranial nerve number 9 is intact, and I see your lips. They're not cracked, they're not dry, they're moist, and they are pink. We're going to move to your ears and your sense of hearing. I'm going to whisper something, and you tell me what you hear.
You care.
Okay. And I'm looking at your external ear. I don't see any deformity. I don't see that anything that stands out for me. I don't see any redness, any swollen, anything is not swollen. Do you feel any pain as I touch it?
No, ma'am.
No pain? Great. And I'm going to be looking in your tympanic membrane. I'm looking at the ear canal, and your ear canal is clean. I'm not seeing any drainage. It's not swollen to me, so I'll pull your ear up and back. I see your tympanic membrane is clear. I don't see any redness, any tenderness at all, and that is good as well. Here I'm gonna palpate your mastoid. Any pain?
No, ma'am.
No pain, no tenderness. Awesome. While we have done your ear, we've done your nose, your mouth, and your eyes, your head. So we're gonna move to your neck. I'm not seeing any tenderness. I'm not seeing any pulsation. I'm not seeing any jugular veins in your neck, which is good. Now we're gonna do cranial nerve number 11. Can you shoulder your shoulders for me? Move them up like this. Strength. Okay. Can you resist this for me? And this. Awesome. So cranial nerve number 11 is intact. Now we're going to move to your chest and lungs. Looking at your anterior chest, I see that it's symmetrical. I'm not seeing any deviation. And I'm looking at your posterior. Your AP diameter is symmetrical. I'm not seeing any kyphosis, no deviation, no deformity in his posterior chest. And I'm going to be doing auscultating for breath sounds anteriorly and posteriorly as well. And so I'm doing your ear right here. Can you breathe in for me? So for the purpose of this video, I'll be auscultating here and here, 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 and here. And we're gonna move to your posterior and here. Can you take a break for me? There you go. So his breathe normal. His breath sounds are clear. I don't feel any excruciation sounds. I'm not feeling any crackles, so no wheezing, none as well. Yes. Okay. And talking now, I'm gonna be auscultating your respiratory sounds, your breath sounds. Breath sounds. So I will do the aortic, pulmonary sounds, your Epps point, your tricuspid, matrial, which is also the point of maximum impulse, the PMI. Okay, great. I'm going to do your respiratory and diaphragmatic. Can you move your seat forward a little bit, Mr. Forchu? There you go. Your respiratory and diaphragmatic excursions. So take a deep breath and hold it. Let it out. There you go. So I'm gonna do diaphragmatic excursion. Take a deep breath and let it out. Okay. Okay, right here. Take a deep breath and hold it. Okay, so here and here. It's between 1 and 3. And so it has to be between 1 and 5. So 1 and 3, it's normal. And that is good. And I am going to be checking your pulses. So we're gonna do your radial pulse, brachial pulse, your femoral pulse, occipital pulse, dorsal pedalis pulse, and an anterior tibial pulse. And those ones are strong at Cophidium as well. And from your pulses, we're gonna do your reflexes. I'm gonna do the reflexes. As a matter of fact, I'm gonna go back and do cranial nerve number 8 because we skipped the Weber and the Raynaud test. And so I'm going to strike this and I'll put this here. You tell me if you feel vibration in both sides. Then I'll do this, I'll put in your mouth stirred. You tell me we're gonna check for your air and bone conduction. Okay, Mr. Forchu?
Yes, ma'am.
Okay, so you tell me if you feel the vibration on both sides.
Vibration on both sides.
Excellent. So cranial nerve number 8 is intact. I'm gonna strike this and I'll put it in your mouth stirred. Tell me when you stop hearing.
Stop. Stop.
Excellent. So the air conduction is 2 times longer than the bone conduction, which is normal. If it was the other way, that would indicate a problem, but it is normal. Now we're gonna do your reflexes. Before we do your reflexes, I'm gonna do your senses. Part of a neurological assessment is to test for your senses. One side is sharp and one side is dull. So you tell me when you feel sharp and dull. So close your eyes.
Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp.
Okay. I'm sorry that was too sharp. Good. So he's got great senses there. Now we're gonna do his reflexes, and we're gonna do your bicep right there. Video, can you see? Okay, there we go. And tricep, and we're gonna do your brachial. Okay, and then we're gonna do your patelia. So let your leg, there you go, great reflex. And then we're gonna do your plantar. When can you stand up for me and put your knee on the stool so I can check your plantar reflex? All right, then. Right here. Okay, and I'm going to do for your Babinski. Okay, awesome. If you flat, that means there's a problem, but you go ahead and have a seat. Mr. Forchu, great work. Now I'm gonna check your muscle strength, and I'm gonna have you resist, pull back. Okay, I'm gonna have you do, can you do rapid? Okay, great. And can you raise your hands? Do this, wiggle your fingers. Okay, can you lift your one knee and the other side? Okay, awesome. And I'm just gonna have you walk to that end. Walk to that end. Okay, walk back on your knees, on your heels. Great. Walk back on your toes. Okay, turn around, walk back 1 foot in front of the other. 1 foot in front of the other. Awesome. Can you bend? Awesome. Okay, can you turn around so we can see you? Close your eyes, put your hands in front. You're checking. Yep. Romberg sign. Did you close your eyes?
Yes.
Okay, great. You're awesome. Now I'm gonna have you lay down so I can check your abdomen and listen to your bowel sounds. Sorry, Mr. Forchu. He almost come all the way. There you go. That would have been an accident. Thank God he didn't get to fall. Those things happen. All right, I'm going to lift up your shirt and I'm going to examine your abdomen. I'm not seeing any scars. I'm not seeing any lesions. I'm not seeing anything that stands out, no bulging. It's not distended. Your tummy is soft. I'm going to listen to abdominal sounds in all 4 quadrants. And here, I'm gonna listen for brood, and I'm doing the periodic, and I'm gonna listen to radial brood. I'm listening to aortic brood, iliac brood, and femoral brood with the bell. And I'm going to lightly palpate your abdomen. Palpate. You got some fluid in your abdomen, Mr. Forchu. And I'm going to do some abdominal percussion in all 4 quadrants. There you go. And I'm going to have you stand up for me. We didn't actually lock this chair. That's why we didn't lock it there. Okay, I'm gonna have you stand up for me. Awesome. Can you have a seat for me? And we are going to do the last thing that I almost forget. It's called tactile firmities. Can you move forward for me? We're gonna do tactile firmities. Can you say 99?
99.
99?
99.
99?
99.
Okay, great. Great vibration. 99?
99.
99?
99.
99?
99.
Good Good job. And do you have any questions?
No, ma'am.
Feeling well?
Yes, ma'am.
We have come to the end of this assessment. Thank you so much.
Thank you.